We work across Leicester City, Leicester County and Rutland, and we have two main focuses. One is supporting people coming out from hospital, and the other is trying to prevent admissions to hospital. We do that in a variety of ways. We provide nursing care, we provide therapy input, so occupational therapy and physiotherapy, and we have technical instructors, healthcare assistants and also admin support who help the service to run really well.
I'd been in hospital on and off for over 2 years. I got two very young children and I was desperate to see them, and it definitely boosted my morale and gave me the impetus to mobilise and improve.
We have 256 beds across the city and county, and we can move those beds around depending on where the people are. So they're called virtual beds. So one bed is in one patient's house, which might be 30 miles from the next patient's house. So across the city and county, 256 beds.
Once I came home, almost immediately, I had a visit from the intensive therapy team from Leicester Partnership. A lady called Rebecca came and did an assessment, and every day after that a physio or an occupational therapist or a specialist nurse called to see me to conduct a slight review and take note of progress.
We have a real mix of patients. The majority are elderly. Some have families, some are post-surgery, some are just patients who have just become a little bit unwell at home. A real mixture from all walks of life.
The first few days saw a big improvement in my confidence, my ability to stand and walk on crutches. I was given instruction on how to get on and off the bed. I was referred to a specialist clinic for lower leg oedema caused by lack of mobility over a 2-year period. My wife was given instruction regarding manual handling, helping me getting on and off the bed, and they provided me with some equipment to help me get on and off the bed.
I think most patients would prefer to be in their own home. We can provide the care, it's a familiar environment, and it's easier for family to support them in that environment as well. The majority would be in hospital, so we're preventing hospital admissions, but also some of them we're helping to get them out of hospital maybe a few days earlier than they would have done normally, because we can provide the support that was traditionally provided in hospital, we can provide in their own home. We get good feedback from the patients, so we have the friends and family questionnaires, and they like being treated in their own environment. They like the way it can be tailored to their own needs, and the feedback we get from patients and their families is really good.
And what would you say to someone who's in hospital or faced with the prospect of going to hospital and they're offered the intensive community support as an alternative?
I think they would be foolish not to accept the help. It's a big boost to morale, and it's definitely beneficial in a number of ways.
We've done some work recently with Loughborough University, and we've been looking at very much what our outcomes, particularly for the patients who are referred from the ambulance service and from our GPs, and the outcomes from those are very positive in that the initial figures that we've not had the full data yet, are showing that 82% of those referrals that we saw in April to October last year, we prevented a hospital admission. So that's really good numbers.
I'd like to say that it's helped me, definitely, and I thank the Leicester Partnership Trust for providing that service.
Our service is good, we have good nurses, you can be seated in your own home, and we can tailor the service to what your needs are to support you to get better. So absolutely, it's a good place to come and be treated at home. It's a much more familiar environment.